Hello and welcome back for episode 39 of the Noobie Dentist Podcast. I'm your host, Dr. Omid Azami. In this episode, I sat down with Dr. Homam Albaghadid out of Toronto, Canada. Homam is a general dentist and academic who is currently working on and researching health professions education. Prior to finishing his dental degree at the University of Toronto and completing a GPR program at the prestigious Mount Sinai Hospital, Homam completed a Master's of Immunology and worked at the National Research Council of Canada. In our interview, we talked about his pathways into dentistry, why he decided to pursue a GPR residency, his academic work, as well as his amazing blog, ReThink Dentistry, which I'll put a link to in the show notes. I wish we had more time to dive deeper into some of these topics, but nonetheless, we discussed many of these important topics such as GPR versus private practice, mentorship, future of healthcare, and dental education, and much, much more. I hope you guys enjoy this episode as much as I did. As always, the Noobie Dentist Podcast is available on iTunes, Spotify, Stitcher, and on my website at newbiedentist.com. I hope that you guys are enjoying these podcasts, and if you are, please don't forget to rate us or like us on iTunes. And if you have friends or colleagues or classmates that you think will benefit from the podcast, be sure to pass it along to them as well, so we can grow the community. Without further ado, enjoy this episode.
Hello, and welcome to the Noobie Dentist Podcast, the safe place for newbie dentists to connect, collaborate, learn, and grow. The Noobie Dentist Podcast aims to provide high-quality and high-value content for all the newbie dentists out there. With your host, Dr. Omid Azami.
So I'm here today with Dr. Homam Albaghadid, who is a dentist in Toronto, Canada. Homam and I actually have indirectly kind of known each other through various friends and mutual friends that we have. Dr. Bruce Freeman being one of them, who's a friend of the podcast, and he's been on a couple of times. Homam is a general dentist working in Toronto, and as always, with these podcasts, I like to kind of just start off with a bit of an origin story, if you don't mind. Tell me about your journey and where you went to undergrad and why you decided to pursue dentistry.
I did an undergrad in Ottawa at the University of Ottawa, and I did originally biology and switched quickly to biopharmaceutical science, and decided towards the end that I'm going to do an honors project. So I stretched my undergrad to 5 years.
Okay.
Obviously, my dad was not too happy about that, and considering my Middle Eastern background, I'm originally from Syria. And then I applied to dental school. Mm-hmm. I had an interest in dentistry from the past, I suppose, my experiences with dentists. And I applied, I interviewed, waitlisted, and basically didn't get in. So I had a backup plan of doing a master's. A lot of people do, I think. And I got into the field of immunology, which I enjoyed thoroughly, and I did a master's for 2 years at the National Research Council of Canada in Ottawa.
Oh wow, nice!
And, published a paper out of it, which was very nice.
Yeah.
And then I applied again to dental school after the 2 years, and the same thing happened. Interviewed, waitlisted, did not get in. So after that, I stayed on at the National Research Council with another lab, and I basically did research for a couple of years. At that point, I applied a third time, even though my dad at that point was saying, "Hey, just pursue a PhD, forget about it."
Yeah.
I said, "You know what? No, I'm going to do it one more time," and I got in. I got in straight to U of T.
The persistence paid off.
Indeed, yeah. And so I did undergraduate dentistry at U of T, and afterwards did a residency at Mount Sinai Hospital, and here I am, working and doing another master's, it seems, in health professions education. So
awesome. So there's a lot
a bit of my academic background. Yeah,
that's cool. And I really appreciate that and respect that, because obviously, I did my undergrad at Western, so I know what the Canadian systems are like in terms of getting into med or dentistry and how competitive things are. So it's good that you kind of stuck with it, because I was a similar position. I applied and I didn't get in, and I was like, okay, I'm just gonna go to Australia and just kind of get the degree done. I can't waste time doing masters and stuff, because at the heart of it, I'm not much of a researcher. I would have not fared too well if I had to sit in a lab and kind of do that kind of thing. So all the more respect.
Well, I gotta say, my interview process at Western was a lot better than U of T. So I had it was certainly a place that I wanted to study at too, considering they approach things a little differently. I think they're a bit more friendly than
I've heard U of T is probably a little bit not the happiest and most collegial place to probably do your dental degree.
Yeah, I think there are people there. Certainly, you got to find them. Yeah.
Awesome. So tell me a little bit about the choice or the decision to kind of, after finishing up dental school, to do a GPR program at Mount Sinai, because I know something that a lot of dental students kind of consider, because there's a lot of good experience that comes out of it. Financially, maybe it's not the best thing, but I guess you have to weigh the pros and cons of that, right?
Yeah, you're absolutely right. So I knew I wanted to do something more after dentistry. I wasn't sure if I wanted to specialize. I was really dabbling in the idea of specializing, and I was leaning towards perio because perio had, at least the people that I sort of connected with, there was an immunology connection. So
yeah.
I thought about that for a while, and I would say in second semester during Spain week and sort of an interprofessional week of education, I met Bruce Freeman, whom you interviewed before, and he gave us a lecture, and I would say he was and still is a very influential person in my life. I consider him a mentor, and going to visit him at the hospital and doing my rotation at Mount Sinai and even at Sunnybrook previously, I thought that I was interested in hospital dentistry. I've spoken to a lot of people at the university about it, and a lot of those people are at Mount Sinai Hospital or happen to be at Mount Sinai Hospital, something I didn't know before. And I decided to apply. Thankfully got in, and I consider it one of the most difficult but rewarding years in my academic and professional, training. So, yeah.
So what would you say were the biggest takeaways in terms of clinical skills and things that you gained in that year?
So there's a gentleman that taught us radiology at U of T. His name is Bob Wood, and he's the head of Princess Margaret Hospital Dentistry. And I remember him saying in one meeting where different dentists were basically talking to graduating students about what to do after. And he said he had done the GPR program, and he had said, it really just makes you fearless. And that really stuck with me. Doing residency just exposed you to so many things that you're not exposed to in dental school. Dental school is kind of, depending on where you go, a bit removed from medicine and the experience of being in a hospital or working with the medical field. So getting exposed to a lot of medically complex scenarios, patients, and a lot of crazy emergency situations.
Yeah.
Working alone in the emergency room, that's sort of what sticks in my mind. You just learn to think quick and innovate and work alone as best as you can in a setting that you're not familiar with. There's a lot of surgery. There's a lot of trauma management, emergency management, and I wouldn't say there's a focus on restorative.
Yeah.
That's certainly something that can be improved I suspect logistically challenging. I would say being around sort of experts in the field. You have to do a lot of self-advocating to get what you want out of it, I suppose. But the emphasis is surgery and trauma management and just better medical training.
Yeah. You just feel more comfortable dealing with like a wider scope of clinical presentations and things like that, which is great. And you have that big like back support, right? I think whereas if you usually when you go into private practice, especially when I was working in Toronto as well, it seems like a lot of dentists own multiple practices, and oftentimes like the new grads are associates in there by themselves, and to have no support system in place to kind of really help them grow or actually be safe in pushing their boundaries a little bit. So I think that's one of the biggest benefits of the GPR from what you're saying as well, and sort of what I was thinking about it as well. I applied. The Sunnybrook program for me was a little bit too medical heavy. It wasn't as much surgical as I had hoped. So when I applied, I interviewed at Mount Sinai with Tannenbaum, Dr. Tannenbaum, and at Sunnybrook. And I think it was like the first year when I applied, I think it was 2006 for the 2016 years, like the first year doing like that official match system. So,
I
didn't end up, I only put Sunnybrook. I only put Mount Sinai. I didn't rank Sunnybrook, and I didn't end up getting in. So I don't know if that hurt me just putting one program. So, that made my decision pretty easy. I just wanted to.
There are a lot of great people at Sunnybrook too.
No, they're both great. And Mount Sinai, I really liked that it was really like surgical heavy. And I got a chance to like Skype with some of the residents and stuff, and they were great as well. So,
right. I mean, in Canada, we don't have the other, I guess, advanced dental training education programs that the US has.
Yeah.
I'm aware of a program not at McGill. I think it is at McGill with the Jewish General Hospital, and it's a bit of a hybrid program. I visited them actually last year in the winter, and just toured the program, just got some input on how they run things, because I'm kind of doing some research in education, and just trying to learn the different formats of training. It's something that I guess, or at least the focus on skill training in certain specialties is a bit lacking. I mean, we didn't do a lot of endos during the GPR, though if you were up for it during call, if you encounter a case where you can do a pulpectomy and learn from the situation, certainly that was available, but not everybody did that. So yeah.
That's very cool. So tell me a little bit. I mean, I've been following your Instagram page a little bit. I know you've had this blog that you've been doing for a little while with ReThink Dentistry .ca. I must say, like, I really enjoy reading your articles. You're a very like articulate thinker, and
thank you.
So I just wanted to kind of get, just dive into that a little bit with you and see where that kind of started and where you're hoping to take things. I think you mentioned earlier you're doing like a master's of like health professionals education. And is that like, tell me a little bit about that as well, and like where you're doing that, or what curriculum that's like?
Sure. So I guess during GPR, I did and wind up applying to Perio, though it was actually they had closed off the applications and then they reopened them. So at that second time I applied, and I was really hesitant. I didn't feel like my heart was in it. I didn't really prepare well. And it was between me and my co-resident, Steven Spano. Hopefully one day you will talk to him. He's a tremendous guy. And I thought he was certainly a better candidate than me. And I'm glad I didn't get in. My interest became education, and it grew out of, I suppose, my graduate years after my original undergrad, and I was really hoping that dental school was going to have a lot more elements of grad school, but it didn't. Some people might disagree with me on this. Certainly, some people that have had a bad graduate year or experience, rather. But I really had some elements in grad school that I thought were lacking in undergrad. And certainly what I heard or read about the different formats in education and how I got trained at Mount Sinai Hospital got me really interested in education. And speaking to different people at the hospital, some medical doctors in the emergency room and in internal medicine, I learned about this master's program through the Department of Family and Community Medicine, and it's basically a master's of community health, and the focus is health practitioner, teachers, education. So it basically offers a lot of courses on understanding the pedagogy of medical education, how things are structured currently in residency programs, specifically in medicine. I think there's very little literature in dentistry and nursing and other fields. So I applied to it. And prior to that, and really prior to while I was doing my residency, I had actually started getting affiliated with a fellowship program here at U of T, also through the General Hospital, Toronto General Hospital, called the Wilson Center. So Wilson Center is basically one of the big centers in medical education research, and I met a lady named Dr. Nikki Woods. I met her actually originally at the Faculty of Dentistry when she gave a lecture on a study that she did with the Department of Radiology.
Yeah.
So I kept in touch with her and ended up joining this fellowship. And this master's that I later applied to, and I know I'm going back and forth here, but I basically, this master's does not require a research project. But because of the fellowship requirement, I have to do a research project, and something that I was interested in. So basically, I structured a research project into the master's, and it's informed by a lot of the sessions that I attend at the fellowship program. And it's not the Wilson Center, but it's a sister program called the Center of Ambulatory Care Education out of Women's College Hospital. So that basically is how I got into all of this. Yeah. And what I'm doing right now is, and I just submitted for research ethics approval. I'm hoping to look at some of the learning and educational practices that are happening at Mount Sinai Hospital, specifically in the emergency room, because I felt and still feel that the emergency room was basically the place where I learned the most during the residency. And it's a quite the unique setting because you're working alone. You just get thrown in, and you're surrounded by medical staff that are a tremendous resource. So yeah, that's kind of how. And I don't know if I totally answered your question there. In terms of my blog, I've always had an interest in writing, and Bruce Freeman will tell you he had to edit a lot of my letters and papers in the past, and he would always basically force me to be more concise, and that's something that I think I still struggle with. But I purchased this the domain ReThink Dentistry.
It's a great one.
Back. Yeah, and it was after a conversation with a friend of mine who has a marketing company in Montreal, and she helped me develop that logo that you see actually.
Yeah.
But I didn't do anything with it for a couple of years, and then during my master's program, this most recent one, they actually force you to develop an e-portfolio, something that the medical students do, and some medical students, I suppose, and some residents. So I turned it into that initially, and because in the process you have to learn how to sort of develop a WordPress website, something that I'm still not totally familiar with. So I turned it into a blog, and I started writing a little more, and trying to reflect on the experiences that I've had in the past and the experience that I have now, conversations like the ones that we're having, really. And I'm hoping that, I suppose, like you, it would be, an avenue to talk to more people. That's
awesome. So what's the just from your writing and things, I get a sense that you're a big vision thinker, and you like to have a bigger picture in mind. So it seems like you have a lot on the go. It seems like you're concurrently doing the fellowship and the master's program to kind of tie in some research and the course-based theory. What's the aim here? What are you hoping to, say in 5 years' time, what are you hoping to accomplish with what you're trying right now?
So I am really hesitantly toying with the idea of doing a PhD. And that would, I suppose, push me in the direction of academia and research.
Yeah.
So the other path that I envision is basically doing consulting and program development, curriculum design, and program evaluation.
Yeah.
Something that I think is at least in the research literature absent from dentistry. If you actually try to find med ed literature of the caliber that you see in nursing and medicine, you don't see that in dentistry. I certainly hope to publish the study, even if it's in a dental education journal, and then see where it takes me. I think there is an opportunity for me to do a PhD, but I'm not sure if I have the energy anymore.
It's a lot of schooling. So what's your plans with clinical dentistry? Is that something that you would give up or really drop down if you're doing the PhD, or?
See, that's the struggle, and I don't think even financially it's sustainable. I'm still paying my school debt. I'm sure you are too. I mean, if I do a PhD, I'd have to cut back a lot because it would be very demanding, and that's my struggle. And at this stage, I have not decided, but I love clinical dentistry. It was, and especially hospital dentistry. I'm really getting into that.
Mm-hmm.
I don't envision myself leaving that. I still debate whether I would own my own office, to be quite honest with you. I feel like if you own a practice, you're really married to it. So if I want to explore all those other interests that I have, I don't think that would be an option for me. So,
it ties you down a little bit.
Partnering up with someone who has similar or different interests, and where you can sort of manage it together, that would be great. I think in the future, I certainly want to continue doing clinical dentistry, and maybe, going down to 3 days and doing 2 days of education research, or, I was telling my I think Bruce the other day that last Monday I worked from 8 until noon, and then I didn't have work afterwards, and I walked out and it was really sunny. gloriously sunny, and I thought, oh my God, I wish I would finish every day at noon. So maybe finish clinical at noon and then doing education stuff in the afternoon.
That'd be a good life for sure.
Yeah. So I don't know how feasible that is, but those are ideas that I'm toying with. Yeah,
that's great. I think I'm with you as well. I think, I mean, for me, it's less maybe like formal education. Like I said early on, I don't see myself as much of like an academic in that sense of the word, but I think it's always fun to, just even for your own sanity and work-life balance and happiness and things, to have things that you do outside of clinical work. Because if you're just working all the time clinically and then that's it, I think like one, burnout, and two, like you kind of get over it pretty quickly. So I'm with you in that it's nice to have those other things that you're actually passionate about and care about.
Yeah, no, I love what you're doing. I mean, you're doing something that is really needed. I feel dentists in our training inherently somehow we tend to be really competitive with each other, and maybe the market afterwards sort of forces you to be that way too. So having avenues like this to talk about what different dentists are doing, I certainly listen to a lot of them, and I think I look forward to see what you do with this. I mean, it's,
Thanks, I appreciate that. Yeah, it's been fun, and like I said, it's great to connect. And kind of for me, my thinking when I first started was just tapping into my inherent lazy nature. I was like, instead of seeking knowledge, I'll just bring it to me, and I'll just that way I can just share it with other people too, so they can sort of benefit from it too, which has been fun. I mean, I get to speak to a lot of specialists and ask them any sort of stuff that I kind of struggle with clinically, and that way they, I get help, and then I share it with people and they get help as well, which is pretty cool. So in terms of dental education, I struggle with that too. The isolation of dentistry is something that I dislike the most, I think. When I look at medicine and the hospital-based setting, growing up, I worked a lot. Like, I mean, in Canada, how competitive it is. You got to start volunteering when you're in grade 1 or something.
I know.
So I was in high school and stuff. I would volunteer in hospital, emergency rooms and things like that. And then I worked as a patient transporter and things like that during my summer jobs, during university and stuff. Get paid pretty well. It was pretty sweet. So I really love the hospital ecosystem, and there's so many moving parts and so many different teams and things. That's the one thing with dentistry that I don't like as much. You're in one room with one nurse. If you don't get along with that nurse, then you're pretty miserable for the day as well. And you don't get to walk around, you don't get to interact. So what are you hoping out of all this, in dental education? Is there room for improvement?
Yeah, I think there's always room for improvement. And I think, being where I am and the director at Sinai right now is a great guy. I mean, Howie Tannenbaum, you know him. He's open to change. I think that's key, is being open to change. If we're very rigid in our thinking and we don't try different things, a lot of people, even speaking to Bruce sometimes, they tend to want, and dental students tend to want more procedures, more time doing things. And I'm learning that there's an argument for the contrary. Certainly the number of procedural skill is important, and developing that procedural knowledge is important, but also that deeper conceptual knowledge is very important in advancing, allowing you to innovate, allowing you to think outside the box and develop your own procedures and do the things that you're doing. Doing a podcast, that sort of thing. Those conversations are important, and I think we do a lot of what the med-ed literature calls direct instruction. You're sitting in lecture, just the receiving end, someone giving you or passing down that knowledge. There are examples of schools where there is that, case-based learning, problem-based learning, which we have at U of T. But I feel that a lot of that is sort of just not well developed, at least at U of T. I mean, that's what I've been exposed to. So I'm really interested in seeing what other schools do, what they do in Australia, what they do in Dublin and Ireland, because and the US, and see how different dental schools are, teaching differently. I think there is room for improvement, for sure. And certainly if you're interested in research, there's room to fill that void as well.
Yeah. So one cool thing about so in Australia, the dental education, medical as well, used to be like undergraduate. So you go straight from high school into dentistry, into medicine, much like it is in like a lot of places in Europe right now. I think probably maybe 7-8 years ago, they started to kind of shift away from that model and go more towards like the North American model of like you get your bachelor degree and then go into postgrad, like dentistry and medicine. But because they've done that, they've kept that postgraduate, they're more rigid to that term, I think. So in like Melbourne, for example, when we went to like a Melbourne dental school and med school as well, they have research blocks within the DDS degree or the MD degree. So for us, we had like dedicated research projects that we had to kind of carry out from like pretty much from like halfway through first year till fourth year, where we presented, there's like research days and things like that. So that was pretty cool. We got to do some like lab work, and a lot of people got publications and things like that.
That's amazing.
Yeah. In the MD stream, it's even a little bit more streamlined. They get a full semester off teaching just to go do research. So they have 6 months of like pure dedicated research time in their 4-year degree, which is pretty cool. It's a bit annoying for me personally because I don't like research that much, but I see the value in it though. Like, learning to evaluate papers and thinking critically, and those skills are important. Even if you're just a general dentist working clinically, with like salespeople coming to you and showing you papers. It's important to like understand at least, what's good, what's research, what's bad research, what's actually, what's being sold and what's being actually shown is important.
Yeah, no, you're absolutely right. And we had things like that. We certainly had the lab work that, we had some mini experiments, if you will, and I certainly would have loved to get more into biomechanics and the biomaterials. I felt that was really poorly taught, at least in U of T. And I might get myself in trouble for saying this, but I like that. I like. I think the distinction maybe is that I'm getting interested in qualitative research, and that really looks. There is an emphasis on the social aspect of things and how we communicate. And I know Bruce, he probably shared that with you on the podcast, if I recall well, that communication is emerging as a key element in appropriate patient care. So and maybe my interest in my research is sort of taking me in that direction, looking at communication. Social aspect. Yeah.
That's important. And, I think it's a big problem. And in terms of the admissions process being so competitive, I think is a big thing, right?
Absolutely.
It's self-selecting for certain types of people who maybe excel like in academia, but socially may not be the most inept. And I find maybe when I came to Australia, because, all the Canadians that come here, like didn't get into Canadian schools, but I thought socially we're a little bit better off because we actually had that social side of things during undergrad and things like that. That maybe hurt the academics a little bit, but you gain the other skills in life that I think are important, maybe more important when it comes to it.
Well, yeah, let me tell you, I was not an A+ student in dental school. I did not fail any courses. I made sure of that, and but I agree with you. Leaving that out is really detrimental. You probably even had more exposure in different areas in the medical field. When you volunteered, I feel like for me, having gone into dental school a bit later and had that exposure socially in other settings, that also helped me.
Yeah.
So I'm sure your experiences sort of allowed you to develop those social skills, and a lot of people. You're right. A lot of my classmates. Struggled with that patient interaction where I didn't, and not that I did anything inherently different. Maybe I just I listened more, and I treated the interaction as a like a conversation again. I wanted to get to know the patient and thought of it as a relationship, and just treated them like I treat friends.
With these podcasts, normally I wish we had a little bit more time, because I think there's a lot of topics to really kind of explore with you. And maybe later on we'll do a bit of a long form Joe Rogan style, like 2-hour podcast, and we'll dive into that kind of stuff, because I think there's definitely a lot of things that you're working through in terms of you're trying to figure out with research and things like that you want to try and improve. And I think they're really important to touch on, because I think dental education can certainly improve. I think some of the restrictions, like we said, are maybe the selection criteria is not the best, because you don't always get the most social people coming into the profession. And 2, I think is maybe it's a conflicting personality thing. With dentistry being such a like technical skill-based thing that you're trying to master, the social, and I'm like that too. Like my personality is a bit more social maybe, but when I'm doing the work, I need to I want to focus, and I'm not, interacting with my nurse as much. I'm not talking, because I feel like when you get into the mode of technician, it's tough to kind of go back and forth a little bit, right? So I think that's a big struggle and something that we got to improve on. And I think that's the tough part in dental school too, because you are spending time learning skills, whereas in medicine, during the MD portion of it, they're just learning theory. They're not learning how to suture. They're not learning how to make incisions and do technical things. Whereas in dental school, we got to squish all that in as well on top of the theory. So it's a little bit denser.
And that's why some people, Bruce Freeman will tell you he thinks that dental school should be 5 years. I agree with him. I think that would be, in retrospect, crazy to do, and also financially difficult. Our tuition is the highest out of all programs, and it's very difficult to. I think it is very difficult to teach dentistry. It's there's a lot of different skills and in different specialties, and you're trying to be a jack of all trades, and there is less emphasis on practice management, communication. You get the case-based learning scenarios where you're sort of discussing ethical issues, or some say child abuse cases, or where you're trying to see how to manage those situations, and but it's not enough, I think, and and who knows? The research might show that it is the emphasis on procedural is more important. I do remember reading in the dental education literature, because I did a paper on this in second year. That's how far back I sort of was interested in exploring education, and there was a warning that we don't want dentistry to become vocational. We don't want it to become just. We don't want to become technicians. We are doctors. We are putting high-speed drills in patients' mouths, and I think that right there describes why it is important to develop that really strong connection with patients and trust. I mean, you're drilling into their mouth.
I'm always amazed by that, especially in the emergency setting. Perhaps like I used to work when I was in Canada. I worked at an emergency practice up in Newmarket, and patients come in. They're not patients. They're not patients of the practice. Like it's their first time meeting you. You literally sit down, shake their hand. What brings you in? And then you're off to you're doing work. I'm like, how does that trust come so quickly that you go from never meeting someone to when you're in trust someone with like a high speed. So that's awesome, man. All right. So what I like to do, just to wrap these things up, just to line things up, is do a quick rapid fire. So I'm just gonna ask you a few questions here, and we'll wrap it up from there. So what's your favorite pizza topping?
My favorite pizza topping would be chicken. I guess. Chicken. Yeah. I don't eat a lot of pizza, but if I had to choose a protein topping, it would be
chicken. Okay. Yeah. What's your favorite band or artist?
Andrew Bird. Andrew Bird is a musician out of Chicago. I really like him. I wouldn't say he's a favorite.
Andrew Bird. I've heard some of his stuff.
Yeah.
Okay. And you should
check him out.
Yeah, I like a lot of music, so I'll check him out. Well, what is your favorite tooth to work on?
Yikes. It must be the anteriors. Yeah. Because you just got to get them perfect.
Yeah.
Anteriors. So I would say incisals. Yeah. The upper incisors and the centrals probably.
Centrals. What's one procedure that makes you question your career choice in dentistry?
Let's see. Something that I really struggle with. I mean, I love doing endo, but it's like picking a lock, man. I don't know. Sometimes it's just when it's going well, it's fantastic, and when it's not, you kind of get sucked into that canal. I don't know.
I feel that's a common one with that answer. Is definitely endos. It's always up there.
Yeah.
Perfect. And if not dentistry, then what other profession would you be in?
I often tell patients it would be architecture.
Yeah.
And I think it's usually architects that I tell this to.
Yeah.
I think it would be architecture. I would like to see what engineers or how engineers learn, because my dad is an engineer, and there are a lot of engineers in my family, and they're really I'm gonna say eccentric people. Very, very, very smart. Yeah.
Awesome. Thanks a lot for coming on. Hopefully
thanks for having me.
We'll catch up in a little bit and hopefully do a bit of a longer one. I want to really take the time to explore some of these things a little bit further with you. So maybe once you kind of get rolling a little bit more with the fellowship research and all that. When you have some answers, we'll kind of.
I should have some data by fall. So
okay, perfect. So hopefully we'll reconnect then, and we'll see how things are going.
Yeah, you bet. Thanks, man. And